preparing to live stream.
Good evening, friends. We're here to have a wonderful conversation, and it's a town hall and it's virtual. And so we can be from all over the state and still be right here with you. And we hope there's folks watching live. But if not, you get to see this later as a taped video because we're being taped as we speak. So we all know we have to behave ourselves and be nice. So you have found yourself at the 802 United. And our guests today are Lacey Kennett and April Homan, and they're from, I've got it right here. They are from the Alliance for a Healthy Kansas, and you'll learn more about them in a second, but we're going to start with just the basics. What on earth are we doing here at the 802 United? Our organization is an educational nonprofit, and our idea is that people in Kansas want to know about things that affect people in Kansas. So it's our ideal to try to present those different ideas, to be a sounding board, to be a voice for people and amplify events and opinions that matter to Kansans. So that's what we're all about. To get started, I'm going to read you our mission statement. The 802 United values the people and opportunities available in Kansas. We strive to make our state a welcoming environment for all humans, utilizing principles that put community and purposeful kindness ahead of ideological extremism. The 802 United is a Kansas-based, nonpartisan, nonprofit organization dedicated to education and awareness of Kansans regarding issues that affect us all. We use the 3 V's method to make change we want to see in the world: voices, volunteering, and voting. Now, I would like to introduce our board member, Tori Gleason, who's going to introduce our other guests.
I have had the distinct privilege of being on a lot of Zooms with these amazing human beings, and so I'm excited to brag about them. Make them uncomfortable when you read an incredibly long bio, because they're great human beings, but it is doesn't tell the story about how truly amazing these people are. So let's start off with April. And April is the executive director of the Alliance for a Healthy Kansas. The Alliance is a nonprofit initiative working to improve the health, well-being, and financial security of Kansans by increasing access to affordable health care, promoting health justice and dignity for all consumers, and reducing medical debt for Kansas consumers. April spent over 2 decades working to improve public policy in Kansas. She started her career as an analyst with the Kansas Legislative Research Department, spent 11 years in a variety of advocacy roles at Kansas Advocacy for Children, a children's advocacy group in Topeka. Most recently served as the executive director for the Kansas Adult Care Executives Association, a professional association for the nursing home administrators and assisted living operators. April is a licensed attorney and holds degrees from Washburn University School of Law and Bethany College in Lynchburg, Kansas. Go Swedes. Lacey currently works as the director of comms for the Alliance for Healthy Kansas. Prior to her current role, she worked as a public information officer in the emergency preparedness at the Kansas Department of Health and Environment, including 18 months on full-time COVID response for the state of Kansas. She also works in public affairs as the executive assistant to the commissioner for the Kansas Insurance Department for nearly a decade. She has a master's degree in communications from the University of Kansas and a bachelor's degree of communication studies from Emporia State University. Her favorite things outside of work include sewing and spending time with her family. Welcome. Thank you so much for being here today.
Thank you.
Thank you for having us.
So I'm going to let y'all in on a little secret. This is Lacey's sewing room. Isn't her wallpaper cool? I just love it. That was an aside. So what I wanted to do is open up the floor to our guests and have you give us some background, just a foundation for this conversation, make a little presentation to us so we know what we're talking about.
Awesome. So we're going to tag team this. One of the things that we wanted to share first is a little bit about the Alliance for Healthy Kansas and how we're going about trying to make change, particularly as it pertains to increasing access to affordable health care. So we are also a nonprofit, nonpartisan organization. And for the last 7 years, we have been almost entirely focused on Medicaid expansion, or as we like to call it, KanCare expansion, because that really is the name of our Medicaid program in Kansas. And also, I think shows that we can do a Kansas-based solution. And there's a lot of room for that as we look into this opportunity and how desperately it is needed. We do policy education, legislative advocacy, and organizing. We have a coalition of over 130 different organizations that have all come together to advocate for this one very important policy of KanCare expansion. And those organizations really run the gamut. I'm not sure that all of them would agree on any other thing except for expansion. And we love the diversity that that brings to our conversations. We have a network of thousands of individuals who care about this issue and are advocating on their own. And we are working every day to get the word out to people across the state so that they understand this policy, which can be a little bit confusing, and that they will join in the movement to get KanCare expansion. Whenever we talk about this, I think it's really important for us to kind of get at least some background information for everybody, because we assume it's been around for such a long time. We know a lot of people support it. And sometimes we find that even our best supporters don't fully understand the way that it works. And so we want to just kind of get that baseline. This is a policy that was first provided by the Affordable Care Act that was passed in 2010. Sometimes the Affordable Care Act is known as Obamacare. And in Kansas, that can be part of the source of opposition because people still are holding resentment toward former President Obama and towards this particular piece of policy. So the goal in the Affordable Care Act was to provide assistance so that people could access affordable health care and insurance from the very lowest income Americans all the way up to people who are earning about 400% of the federal poverty level. The federal government pays for 90% of the cost of this, and the state just needs to cover 10% of the cost. There aren't a lot of matches that you will find like that anywhere in federal government. And then we know that there are about 150,000 Kansans who would benefit if we were to expand eligibility for KanCare. I don't know, Julie, are you the one who's going to be putting up the slides? Could you put up the first slide that's an umbrella? So what I wanted you all to see is a visual of what we're talking about when we talk about the coverage gap, because that's really the problem that we're trying to address. So when the Affordable Care Act was passed, they had a full umbrella that would cover those people from the very lowest income up to people earning 400% of the federal poverty level. Whoa, got a little carried away there. The people on the left side, the people with the lowest income would be in the Medicaid program. The people on the right side, that's blue, would be in receiving marketplace subsidies. If they were to go to the Affordable Care Act marketplace or healthcare.gov, there are tax subsidies that are available that really bring down the cost of private insurance. And then that was how the umbrella was going to work. Unfortunately, there were a lot of challenges to the Affordable Care Act. And one of those challenges was that states, the Medicaid program is a state and federal partnership. And the Supreme Court ended up saying that states cannot be compelled, they can't be forced to participate in expansion. And so they said that each state would need to opt in specifically to do expansion. And the first year that they could do that was 2014. There were quite a few states who just took advantage of it right away. But now it's been, almost 10 years since that first state took advantage. And here we are in Kansas, still dragging our heels. So the way that our system works with this broken umbrella is that in Kansas, most adults don't qualify for Medicaid, no matter how much they make. There are a few exceptions. If you have a child under the age of 19 in your household, then you can qualify for KanCare if you earn no more than 38% of the federal poverty level. So all of that is based on household. So I can't give you just a set amount, like this would help people earning over blank amount, because it depends on how many people you have in your family. But for a family of 3, so say a parent with 2 children, that parent would not be able to earn more than $9,000, basically $500 a year before they would already be earning too much to qualify for KanCare. So if you think about the amount of money you need to live in most communities in Kansas, you can imagine that there are not a lot of people who are able to qualify now. On the other side of that, because of the way that the Affordable Care Act was created, you have to earn at least 100% of the federal poverty level in order to qualify for those subsidies. So in the middle, that no coverage part of the umbrella, those are parents who make more than 38% of poverty, and those are every other adult who does not qualify for expansion because they don't meet that special exception. There are a couple of other exceptions if you're receiving Social Security disability payments, or if you are pregnant up to a certain level of income, you can also qualify. But by and large, most adults don't qualify. Okay. We can, if you don't mind, well, actually, we can leave that up for people to think about. Our eligibility limits in Kansas with that 38% of federal poverty are just unrealistic. They need to be fixed, and expansion is one way to fix them, and at the same time, make sure that we completely close the coverage gap. So the next slide gives you an idea. Actually, I'm going to skip the next slide and go to the following one that's a map. Okay, so just for your reference, 40 states out of the 50 have already taken this move to expand eligibility for their Medicaid programs. This is a map that shows those states, and you will notice that these are traditionally red states, traditionally blue states. This is really not a partisan issue. And you'll notice that all of the states surrounding Kansas, every one of our neighbors has already moved ahead. So I should have clarified, the dark blue are the states that have already expanded. The orange are the ones that have not. And North Carolina with that light blue, they've already passed the legislation to do it, but it doesn't go into effect until the beginning of next month. So when you look at this map, it's pretty easy to see some strange things. Usually Kansas does not benchmark our policies with the Deep South, but in this case, for the most part, those are our peers in the holdout states. And you have to ask yourself, why is that happening? And why are we so out of touch with our neighbors? I think that's we don't need this slide anymore. I'm going to turn things over.
That's the take home point. It's all around us. Why not us?
Exactly. Thank you so much, Julie, for doing that. I'm going to pass things over to Lacey to talk a little bit about why expansion is so urgent in the upcoming year, and some more about her specialty, which is communications.
Yes, thank you. So I'm going to kind of rapid fire some of our reasons. There are many, many reasons that we should do this, but I'm going to kind of rapid fire some of the arguments that we find to be the most compelling. So, as April just said, the eligibility limits for KanCare in Kansas right now are incredibly low. They're too low. So that single parent with 2 children can't make more than about $9,500 per year, which is some of the lowest thresholds that we have in the country. And so this would allow a person, that parent, to make more money and still be able to get affordable health care. It also reduces healthcare costs for everyone. So it doesn't matter if you have KanCare coverage, if you have private insurance, even if you're on a program like Medicare, expanding KanCare will reduce healthcare costs for everyone, because when a hospital or a healthcare provider has uncompensated care, we all pay for it, right? Uncompensated care is the care that a hospital provides that they don't necessarily get paid for from an insurance company or a person. Then they inevitably must raise the rates that they charge for services and things, so we're all paying more. It'll, in a similar vein, help protect Kansans against medical debt. So we know that 4 out of every 10 Kansans have experienced medical debt themselves, or they have a loved one or family member who has a great deal of medical debt. So this is another way that we can protect people from that. It'll help us preserve and strengthen rural health care. So we know that Harrington Hospital just closed, I think it was last month, leaving kind of a hole there for care in that area. We know that the emergency department in Fort Scott recently had to close down. And so every time that happens, there are more Kansans that have to drive further or otherwise, take longer to get the care that they need. And so
Or
this
they
is
just
not,
don't get the care.
exactly, or they just don't get the care, which is just as bad, if not worse. So this is something that will help our rural healthcare providers, but also just our rural communities. Expansion will help make Kansas more economically competitive. So that map showed that every state around us has already expanded their Medicaid program, which means that especially in border communities, you've got healthcare workforce that might choose to go work across the border because of the financial situation of the hospitals and places like that. If a business is looking for where to locate, they might rather locate in a state that has coverage and that doesn't have that coverage gap like Kansas does. So it will keep our state as a whole more economically competitive. It also will help to address some general workforce shortages in Kansas. So we know that virtually every industry in Kansas would benefit somehow from Medicaid expansion, but you see a lot of it in the hospitality, the food and restaurant business. There's some education, ag, and farming would especially see a lot of help from expansion. And finally, it just would ensure equitable access to affordable healthcare for all people, regardless of your race, your income, your zip code, anything like that. It just gives all Kansans the opportunity to achieve health and achieve their goals in an affordable way. So those are kind of our quick rapid fire arguments for you. What we at the Alliance encourage people to do is, if this is important to you, if you care about this, most people probably know someone in the coverage gap or have lived in the coverage gap themselves at some point. I know I have. So what can you do? Well, we are really focused on grassroots advocacy, and that means that we are counting on every single person to do what they can in their sphere to make a difference. We want to build a movement so big and so loud that the policymakers and the people who make decisions in the state house can't ignore us anymore. So talk to your friends, your family. If you're in a book club or a civic club, talk to them. We will talk to groups just like we are right now, and just spread the word about how important it is. You could also do things like writing a letter to the editor in your local newspaper, which is great. You could make a really short video and post it on Facebook about, this is why I support KanCare expansion, that actually goes much further, I think, than most people know. And then if there's an event or something in your community, participate in it. If there's not one, host an event. There are lots of things that you can do, and we are always here at the Alliance to help you. If you want to talk it through and get resources, we have those. So that's my quick pitch. I'm going to throw it back to April.
And so I want to just say, if you're interested in joining in on the legislative advocacy, the most important thing you can be doing right now is introducing yourself to your legislator if you don't already know them, because it's really good to already have a relationship before you are asking for specific things. So we recommend that people reach out and just introduce yourself, let them know that you're a member of their community and a constituent, and let them know generally what you're interested in, but kind of wait on those hard asks until we get into the legislative session, because the more times you contact them, the more familiar you'll be. So hopefully you'll be contacting them quite a bit. You can email, call, or write your legislator to make your case as we get into January at the beginning of the legislative session. And then we also want to make sure that people are reaching out to even those legislators who oppose expansion, because you could ask them, if nothing else, to make sure that there's a hearing this year. We have not had a hearing on expansion legislation in the Kansas House since 2017. We haven't had a hearing in the Senate since 2020. And the reason that we haven't had that is because there are a group of powerful legislative leaders who have shut down any conversation of this policy in the State House. So there haven't been hearings, and we are really kind of wanting people to understand that it is those legislative leaders, and particularly the Senate President, who is Ty Masterson from Andover, the Senate Majority Leader, who is Larry Alley from Winfield, the Speaker of the House, who's Dan Hawkins from Wichita, and the House Majority Leader, who's Chris Croft from Overland Park. Those are the key leaders that we really need to convince to be able to get this to move forward. And with that, I think we'd really, hopefully we'll be able to answer some questions. And Lacey, I think you wanted to maybe talk just a very quick bit about our social media and other ways to engage.
Yeah, I just want to let you know where you can find us at the Alliance. So we're on all the places, I think. We're here on Facebook, we're on Twitter or X, Instagram, and TikTok. Our handle is @ExpandKanCare on all platforms. We also have a podcast. If you are a podcast listening person, it's called Health in the 34th, and it is available on Apple Podcasts, Spotify, really wherever you get your podcasts, or we have links on our social media, and we do deep dives with really awesome, cool people who know a lot about particular topics. So I want to give a shout out there. And our website is expandkancare.com. Come find us. We have lots of good stuff there.
And I want to encourage people, if you happen to be tuned into the Zoom and you want to put a question in the chat, go for it. If you are watching on Facebook now, you can comment on the post of the event, because I'm keeping an eye on that over here on my phone, in case anybody comes up with a comment with a specific question. I wanted, just based on my experience of looking at your website, something I noticed is that the huge list of organizations that you work with. And you mentioned, April, that what you're really after is to incite grassroots groups. We're not about necessarily having some big corporation sponsor this. This is about what do the people need and what do the people want, and getting our legislators to be responsive to what we need and what we want. So, but what kinds of organizations have you been working with that we might recognize or we might not?
Yeah, so we have a lot of organizations on it. They're all listed. And if you represent an organization and want to be part of the coalition, come join us, please. But like April said earlier, we have about over 130 organizations, everything from churches to hospitals and specific healthcare providers. We've got advocacy and specialty organizations like the American Cancer Society, the American Lung Association, groups like that. We've got physician groups, like the American Academy of Physicians Kansas chapter. Really, the Kansas Silver-Haired Legislature is our newest one.
I love that.
I think we have a poetry group listed on there too. So like, you don't have to be healthcare focused. If you just support this, come join us. We would love to have you.
That's great. We have a question in the chat about who is it that has set this 38% federal poverty level? Try to say that 3 times fast. Who put that in place that has created this huge coverage gap?
So the Kansas legislature, that is in statute. So that has been actually in place for quite a while. And I think that it's time for us to move away from that. It is just not realistic in this day and age. And I think that there is a lot of thinking that's still stuck in, 20 years ago or 30 years ago, when most people would get their coverage, healthcare coverage with their job. Almost everybody would do that. And now there are so many different jobs that don't come with insurance, or people can't afford the insurance, the employee part of that insurance. I think I saw a study reported, it was part of a look at people who are not covered by insurance that the Kansas Health Institute did recently. And it showed that just over 50% of Kansans receive their insurance through their job, and the rest of us don't. So those are people who are scrambling to find coverage, and many of them are going to fall in the coverage gap.
And then they're going to have to receive care on an emergent basis because they can't afford to go to the visits for the preventive care. And then they sink themselves into medical debt, which is where that goes.
Absolutely.
You've talked about rural health care. What about the benefits as far as mental health care in Kansas?
So there's, speaking of the Kansas Health Institute, we commissioned, we had a particular area that we wanted to look at, and that was mental and behavioral health. So we kind of asked them if they would look into it. Their research was all their research. We just said, hey, can you look into this? And it really showed that there are a lot of benefits in that area that you might not expect. Things like reduced recidivism in the criminal justice system, things like fewer children going into foster care due to neglect. So that report is linked on the homepage of our website if you scroll down. And so there is the obvious benefits of more people receiving mental health, more providers able to give that care because of that additional revenue stream, things like that. But there are also really far-reaching ones that we weren't necessarily expecting, but are just confirm our resolve even more to work on this issue because the effects are so far-reaching.
Well, and Julie's big emphasis is always education. And I have to imagine that if families with school-age kids have medical insurance, you're going to reduce the amount of time those kids spend out of school. You're going to have kids in the classroom learning, becoming productive members of society. Because I feel as though when I see, Governor Kelly has been all over the state holding these like open house conversations about we need to do this and we need to do it now. And then she'll post something about it on Facebook and people come out of the woodwork to say why this is not a good idea. And I still am hearing the fallacy of people just want a free handout and they need to just go work. And these are working people that we're talking about. But our economy has shifted. Things are not what they were, like you say, where people get benefits from their job. I'm a contracted physician. I'm not saying I don't make enough money, but I don't get any insurance. I get that, thank God, through my husband's work. So obviously I'm a hardworking person. I'm not someone who's trying to get something for free off the government, but it is just a reality that almost half of Kansans are not getting insurance through their work, and they need another option.
Mhm.
Absolutely. And I think you touched on something really important. If I could just interject really quickly, there is a lot of evidence that shows that if parents are covered by insurance, then they are more likely to sign their children up for it as well. So even though we're talking about a policy that would specifically cover adults, it could also, and we expect that there are, dozens of children or dozens of thousands. What's the best way to say that? Like about 30,000 children who would be covered by the Children's Health Insurance Program if their parents gained access to Medicaid. And that's really just because it's not a reality for those families right now. It's not on their radar. And if the parents were to be able to get the coverage, it would make a world of difference for the children as well.
What other kinds of objections do you hear? What are the barriers to doing this?
A lot of times we hear that this will somehow harm people with disabilities by putting them at the end of a line. That really couldn't be farther from the truth. We know that many of the people in Kansas who have a disability do not have the Social Security disability determination. And so they don't count that, it only counts for this purpose if you have that federal determination of disability. So about 75% of the individuals who have a disability in Kansas do not have that designation or determination for one reason or another. One of them being that it's very difficult to get that. And sometimes people have to try for more than a year, 2 years in some cases. So that is one of the reasons, because this would help individuals who have disabilities to get the access to the healthcare they need. And a lot of the personal care attendants who help individuals with disabilities fall into the coverage gap as well. So I think that that's the reason that every organization that supports people who have disabilities in Kansas supports KanCare expansion. What else do we hear? I think a lot of times we will hear that it will bankrupt the state, and that every state that has done this has regretted doing it. This is not a permanent decision. So any state that has gone down this pathway can turn around at any point, and no state has done that. So I think that's really evidence of the fact that it's not really bankrupting states. In fact, there are many states who indicate that this is actually having a positive fiscal effect, because it's bringing all of those dollars, federal dollars, into the economy, and those have a multiplier effect throughout the economy. So I think that, most of the opposition that we hear, it tends to be red herrings or distractions, as opposed to real problems with the policy. I think it kind of boils down to some people thinking government should be small and seeing this as a way that government would be increased.
I've seen that as something, a card that people will play. And what they're trying to say is that if we expand KanCare, that's just going to shift the cost from the government to the taxpayer. And I don't want my tax dollars going to give that person healthcare. How do you address that?
Well, we're doing it now. So we are doing it for people who live in Missouri and Colorado and Oklahoma and Nebraska and California and Massachusetts and New York. We're doing it for people in 40 states. That ship has already sailed. And so by holding out, we aren't changing the policy of the Affordable Care Act. We're just hurting ourselves, the individuals who are in the coverage gap in our state and the providers who are caring for them. And it doesn't make sense.
And you kind of address sort of the state economy and the fiscal impact of expanding KanCare. But for small town Kansas, there are certain facets of life, like pillars that hold up these small towns, and that's your school, and that's your bank, and that's your local clinic or hospital. Any one of those goes under, the whole town is derailed. So you keep the hospital open, you've got people working. And if they're working, they want to live in your town, to work in your town or close by. And they're going to spend money in your town, and it's going to benefit the entire community, the entire local economy. That to me is just common sense. But
Absolutely.
people really think the opposite. And I'm like, no, really, it's going to help. It's going to be good.
Right. We hear from our partners in economic development that it's a really big part of attracting businesses and getting businesses to stay in communities as well. If there's not a full service hospital in the community, that can exclude any app or any attempt to try and land certain businesses. And so we're seeing more and more, not only that rural hospitals are closing, but that even if they're not closing, they're closing down a lot of the services that they provide. So that's another thing that I think, because we don't have as much reimbursement and we have more uncompensated care, we're really at a disadvantage to those communities across our borders.
I've seen that too, because I follow this pretty closely as a physician. I want my patients to be able to have insurance so they won't say, I can only come to 2 prenatal visits, or, whatever their issue is. Because the problem, pregnancy is covered, but the people I care for have a lot of other medical problems. And if it's not directly related to their pregnancy, their insurance company can say, nope, that's not covered because it's not part of their pregnancy care. So this is personal to me. This is affecting my mamas and babies, and it really, really gets me. And now I've totally lost my train of thought. But it was talking about this idea that if you expand Medicaid, KanCare in Kansas, that's actually going to make it more likely that hospitals would close, because now they're going to have all of these more patients coming in, and are they going to have the resources to care for them? And the answer is they have more patients coming in whose bills will be paid, because if they have health insurance, the bills get paid. As opposed to, we have a federal law that says, if you show up in my emergency department, I have to care for you. It doesn't matter whether you have a thin dime or not. You are my patient, and I'm going to care for you because of this thing called the EMTALA Act. And that's true for every hospital. So if they're ending up caring for so many uninsured patients, that whooshing sound you hear is all their money going out the window. Whereas if they're caring for insured patients, it makes them on more solid footing.
Absolutely. And that's why all of the Kansas Hospital Association and so many hospitals individually are part of this movement, because even though Medicaid pays less than a private insurer, for instance, and so there are issues there, it pays more than nothing, which is often what they are going to be able to get from patients who don't have insurance. And I'm not saying that in a way at all that disparages those individuals, but it's just the truth that some sort of payment is better than nothing, for sure, for those hospitals and other providers who are caring for people who are in the coverage gap.
There's a question in the chat about what % of emergency department visits are non-insured in Kansas?
That's a really good question.
Yeah,
and
I don't have that number off the top of my head, but I'm gonna go over here and Google while we're talking. I would love it if you guys, one of the things I loved about your website is that you have stories of everyday Kansans and how they're affected by this coverage gap. It's like a farmer, a trucker, everyday person. Would you give us one of those stories?
Oh, sure. So yeah, and my favorite thing, our website is relatively new in the last year or so. My favorite thing is that you can search the stories based on like keyword. So if you're interested in stories about people who have had cancer or something like that, you can actually search and find people with stories like that. It's a good way to see how many areas of society can be affected by the coverage gap. But yeah, so we've got, like you said, farmer, our storyteller, farm worker, his name is Jim, and he's from the Wichita area. And he did farm work his whole life, and he loved doing farm work, but as he got older, he had some health complications, and he didn't have insurance because it is quite common in as a farm worker to not have that health coverage. And the work they do is sometimes so dangerous, and it's labor intensive. It's really hard on your body. So, he just started having health issues, and he didn't have health insurance, and it caused him to stop being able to do what he loved, which was farm work. So we've got him. One of our more recent stories is a lovely lady named Robin. And she is I don't know how much people watching will know about this, but since the end of the public health emergency for COVID, they started renewals for KanCare again. During the pandemic, if you were in it, you wouldn't lose your coverage unless you moved out of state or you asked them to, right? Once the emergency ended, then they started that renewal process, and you had to qualify again. And unfortunately, Robin is one of the thousands of Kansans who was working more hours, and therefore her income was too high, and she no longer qualified for KanCare. So she just recently lost her coverage, and she's got health things that she wants to get taken care of. She had gotten some really good care during that time, and she was in a really good place, and then that coverage dropped, and now she's just not quite sure what she's going to do since she doesn't qualify for subsidies on the health insurance marketplace. So we've got all sorts of stories. And if you are watching and you are in the coverage gap, or maybe you work with people in the coverage gap and you want to tell us your story, we love to share those. I think it really gives a face to the coverage gap. It's not just this nebulous group of people who, as some might say, don't want to work and just want healthcare. These are people with families and jobs and lives. And we just really appreciate every one of them for sharing their story with us, so that we can show everybody who is in the coverage gap. Who are we talking about here?
Looking at an article that says uninsured using emergency room as primary care. I'll tell you what I find out. There was a KFF article about 1 in 6 people visiting the emergency room ended up being out of network. And that's another issue, whether you have insurance or not. If you're in Medicaid and you're in Kansas, you're going to be in network. But if you have private insurance and you show up at the wrong emergency room, you can still end up in medical debt.
Mm-hmm. If it's okay, I'd like to go back to the conversation about rural hospitals. Tori was kind enough to put a link with a little bit more data on that. So the latest data shows that 82% of our rural hospitals have had to shut down services. So kind of back to that conversation that we were having before. And a total of 85% of our rural hospitals are at risk of either immediately closing or just generally being at risk of closing. So pretty scary situation out there. And although expansion wouldn't be the only thing that's needed to save all of those hospitals, it certainly would be a really good first step. And no matter what kinds of innovative things we do to help with the rural hospital delivery model, we still need to have a payer source for all of those new innovations. And expansion is a way to pay for some of that and a way to keep those hospitals viable.
Still reading. I'm in Utah now, looking at uninsured people using the emergency department.
Can I give a shout out of something of a resource that we have on our website?
Yeah, go for it.
A shameless plug. That's what I was going for. So if you go to our website at expandcancare.com, there's a menu in the corner. If you click on learn more, that's where we keep a lot of our resources. And in there, we've got a list of county fact sheets. So if anybody is curious what impact expansion would have on their county specifically, you can actually go in and pick your county and click on it. And it's a PDF. You could even print it and hand it out, whatever. But it'll talk about how many people in your county would become eligible for that affordable health coverage under expansion, how many jobs, how much in new annual healthcare spending. And so I would really encourage people to go check that out and just see the impact that it would have on your community, whether you're in, is Johnson County the most populous? No, Sedgwick maybe is the most populous, or, Wilson. It's going to make a difference.
This is telling. So you can't see this because my camera won't focus on it, but it is a little ticker that is going by incredibly quickly. And it says Kansas dollars lost while we wait for expansion. And it's in the billions and billions of dollars. Scary.
Over 6 billion.
Yeah.
And that's ridiculous. I think that my brain kind of fuzzes over when I think about amounts that high. But we did a little bit of research a few years ago when it was still at 3 billion, and it would have built like 3 airports the size of the one that's relatively new in Wichita. The Kansas City one hadn't been built then yet. But if you think about that and the technology and the infrastructure that you need to build an airport, and we could have done it like 3 times if we had accepted those dollars. And, obviously that's not what the federal dollars are for. They would go to help Kansans pay for healthcare. But just to give you an idea of the magnitude of money we've turned away. And our neighbors are accepting those dollars and putting them to good use.
Looking on your website, obviously expanding KanCare is top of the line here. You're also talking about KanCare coverage enhancements and cost efficiency. It sounds good. What is that about?
Well, it really goes back to we have a managed care system in KanCare in our Medicaid program, and that is out for a rebidding process. Not redetermination. Is that it?
The RFP process.
Right. Yeah. So anyway, reprocurement is the word that I was searching for. So we are in the middle of that process, and our hope, as we have been, participating in opportunities for public comment and working with consumers, is to make sure that the next iteration of KanCare is as friendly to consumers as it can be. And so that really is the center of the work that we're doing there. And the RFP went out in September. And I think that, as we look in the months ahead, we're going to be hearing about the companies who win those bids. And really, it's going to be important for us as advocates to make sure that the process rolls out in a way that is most beneficial to the people who are participating in the program.
Nice. Just found America's Health Rankings website, and it turns out that we are 33rd in percentage of people who are actually covered by insurance out of 50. And our uninsured rate is very close to 10%, which is like the darkest place you can be on this coverage map here. We're like right up there with Alabama.
That's pretty recent. It's just in the last, I think, 2 years that Kansas's average uninsured rate actually went above the national average. We'd always been below, but in the last couple of years,
I don't know if my internet just froze or Lacey's just froze.
I think it might be Lacey.
There we go. So yeah, it's not something to aspire to, obviously.
No.
But I do wonder how much of that is related to the pandemic emergency ending And that's how we got a bunch of people that fell off the rolls and a bunch more uninsured people.
That's being phased in right now. So there are people finding out every month that they're losing their coverage because of the redetermination process. And I think that unfortunately, there are still people who are that's coming to them as a surprise. They didn't realize that was happening. So we want to make sure that people who actually still qualify know that this is coming, and to look for those letters and respond to them as quickly as they can, so that as long as they do still qualify, they're not going to see any breaks in their coverage. It's really, really important.
I can't find the actual percent of emergency room visits by uninsured, but one of the things that this site of America's Health Rankings is talking about is preventable hospitalizations. So people that get so sick because they're not doing their preventive care that they end up being hospitalized, whereas if they had been able to afford their medication, go in for their health screenings, if they had been able to do those things because they had health insurance, they wouldn't have ended up in the hospital. So that's, I think, a very important number as well. Because I got to tell you, hospitals are places that have big bad germs that you don't have at your house. You do not want to get what's called a nosocomial infection, which means a superbug that we grow in the hospital, right? You want to be home in your house where you get to make sure you know what you're surrounded with. But it is a big deal. It is a big deal to prevent hospitalizations every chance we get, especially older people. That's a slippery slope. You have someone that ends up in the hospital as an older person, the likelihood they will come out of that hospitalization and go back to their house gets vanishingly small. And they end up having to go to some sort of rehabilitation and then to a skilled care unit. And it's just a trap door right to, you don't get to live in your home anymore. So we need to honor our older Kansans by making this happen.
Absolutely. And expansion itself applies to people who are between the ages of 19 and 64. So before you would enter into Medicare. But there are a lot of older people who find themselves having real health problems and not having insurance. So the coverage gap it's a big challenge, particularly for people between 55 and 65. As they're starting to see more, as they're starting to have more problems with their physical health, and they're, not quite to the point where they qualify for Medicare.
Well, Julie, I failed at answering your question in the chat. Do you have any other ones for April and Lacey, if she's able to get back on?
Poor Lacey.
No, I just find this so fascinating that we have obstructive legislators basically that are unwilling to support our community members that need it and our hospitals that clearly need it. The fact that we have 82% of our rural hospitals that have shut down one or more services, that is frightening, especially the further west you get and the further apart those hospitals are. It's just unbelievable to me that we allow that.
And from an obstetric perspective, one of the first things to go is maternity care, because hospitals call that a loss leader. It costs a lot of money to take care of moms and babies because it's an intensive care situation every time someone's given birth. You got two humans you're trying to keep healthy at the same time. On the other hand, if that family births with you, then they're also going to bring all their other family members to you, because that's a very special place to them. So in a crowded urban situation where you want those people to come to you, you want a fancy schmancy birthing center. So everybody wants to come have their baby at your place, because then they're going to bring grandma and Uncle Charlie and their kids and their spouse who never wants to go to the doctor and never wants to go to the hospital. They're going to bring them all to your hospital. Now, if you're a rural hospital and you're the only game in town, having that loss leader is not friendly to your bottom line. And so then we end up with maternity care deserts.
We also hear from people who are like rural physicians in Johnson County, specialists who are seeing people from Western Kansas on a regular basis because there's no one else in their specialty anywhere closer. And when you think about the difficulty of the individuals who are driving all that way to get their, you know, regular allergy care or whatever it might be, it's prohibitive for a lot of people, and it's a real inconvenience and probably a loss of at least a day's work if you are making that trip. So you start to see in the nuts and bolts of what going without expansion is doing, it's making life a lot more difficult for people.
And you know, when you think about that loss of a day's employment and being able to contribute that what you would have made to the economy, it's not just our patients that are going to Kansas City. I don't know how many times I had to take a day off to take my mom to see the voodoo ENT guy at KU Med. It's such a, it would be much easier if she'd had a doctor right there.
Yeah.
Much easier.
And if you have kids and you're still paying for childcare that day because you can't drag them with you, so now you're paying for childcare, you're paying for transportation, you're not getting paid, it's a domino effect.
Mm-hmm.
So, I mean, to Julie's point, wake up, legislators, and listen to Kansans, which means we as Kansans have got to speak up and make them listen. Your point, April, about getting in touch with your legislator now so they know who you are and they know, oh, that's one of my constituents. It doesn't do me any good to talk to somebody who's not my representative, except in the sense that if they're a committee member or a committee chair and they can get something to get a hearing, that's a great tip. And I want to, I'll be going back and looking at this video again and writing all that down and posting that on our Facebook page to say, here are the emails of the people that can get KanCare expansion a hearing. And then we need to show up. We need to send in our written testimony, our video testimony. Calling their office is important, or emailing their office is important, but I'm going to speak against form letter emails because they don't really have as much impact as you might think. Do I sign petitions right and left about something I'm passionate about? Sure, I do. But if I really want to make a difference, I'm going to write a handwritten note. Because when I was in Washington in May learning how to be a better advocate, that's what they said. Handwritten notes, personal phone calls, be brief, be to the point, and have an ask.
Yeah, I think that's really good. So we don't usually say this, but I think that, you know, we want expansion and we want people to support that. We also just want a hearing. So I think that that's, you know, we sometimes need to ask our legislator to put pressure on their elected leader to allow that to happen. And so, you know, that's not a comfortable place for them to be in. I think we have to understand that, but yet it's necessary and those conversations need to be going on.
This is something that has consistently been gauged, you know, between 70 and 80% of Kansans want this. And I think particularly telling is in the recent poll from Fort Hays State University Docking Institute. It's called the Kansas Speak Survey. They do it every year. 50% of voters said this was highly or extremely important to them. 50% of voters said Medicaid expansion was highly or extremely important. So that's
like,
a big number.
Yeah, and more like 70 said they support it. But,
yeah. But 50% said it was extremely important, and that makes us happy because it's extremely important to us too.
Well, we are winding down on our time together. Yeah, it's almost 8 your time. It's almost 9 my time. So any last words from you guys? And then I'm going to let Julie introduce our December town hall. So we'll keep you all on the hook. Last words from April and Lacey.
We are really grateful to have other people in this fight with us, and we hope that we will together be able to make enough noise to get over the political obstacles this year, because there are so many people right now who needed the care 3 years ago, but at least we can get it this year. So please stay with us, and please lift your voices on this.
Ditto.
All right, Julie, what do we have on the plate for December?
Well, first of all, I want to thank April and Lacey, as one of my friends always said, this is an eye-awakening experience for me. I knew it was important. My son is in healthcare. He talks about it, but it's not just important. I think we're almost in a dire situation at this point in the state of Kansas. So we've got to make some movement here. So in December, we are going to have another nonprofit join us, the staff of the Kansas Reflector. And the Kansas Reflector is part of what's called the State Newsroom Network. And they report solely on, well, that may not be true. They report on state and local government and what's going on. If you've paid any attention over the years, the newspapers have dropped those reporters. So we as citizens have not always been informed about what actually happens at our state house. And that's what their role is. And they're going to talk about their role and how they go about doing it, and how they try to give people who don't have a voice in policy and politics in Kansas that voice. So I've heard them speak once before. They're very good. I'm really looking forward to them too.
These just get better all the time. I have so enjoyed my time with you guys. Thank you. Thank you. Thank you for coming to be with us
Thank you
tonight.
so much for having us.
Yeah,
This
thank
is
you for
wonderful.
having us.
Take care.
Bye, everybody.